Hi there and welcome to Gaining Vision. I'm Melanie. Thanks for joining me once again, and if you're new, welcome. Please don't forget to subscribe to my channel and please don't forget to like and share. Today we're going to talk about invisible disabilities. When you think about disability, our first thing is we think of somebody in a wheelchair, somebody who uses a walker or a cane, or perhaps somebody who's blind. Something that we can see. But there is so much in the world of invisible disability that we may not even consider. So let's start by saying, what is disability? So a definition of disability is actually focused on when something affects your daily living activities. So that could be your ability to cope, to work, to do daily skills like dress yourself, feed yourself, get around, something that's going to impact your life. Perhaps it's going to affect how you learn. So with invisible disabilities, it could be anything from a learning disability, something that you can't see, but inside may be a different way that you learn, and you may need accommodations to help that. It could also be something invisible, like a chronic illness. It could be arthritis. It could be diabetes. It could be MS. It could also be depression, anxiety, or other mental health conditions. Things that may affect our lives, and sometimes, a lot of the time, they're episodic. And what that means is you never know when they're going to flare up or happen. And people, to look at somebody, think that there's nothing wrong with somebody. And there really isn't anything wrong with them, but they may be in pain, they may be suffering from a tough moment, a tough experience. And so we have to also include these because there are ways that we can help these individuals lead fulfilling lives with some accommodations, perhaps some flexible time. Some people with invisible disabilities may struggle in the mornings, and in the afternoon they're better. So the job they choose may be something that's focused on the afternoon. But we're quick to judge people with invisible disabilities because we don't know the full picture. A lot of them get labeled as lazy, or perhaps odd, or angry, or just depressed. And the reality is, we don't know what's happening behind closed doors or within their bodies. But the more we're educated on invisible disabilities, the more empathetic we can be towards them. I know a lot of my friends have invisible disabilities, and for them, it's just setting a pace that's going to work for them. They're never know what's going to happen that day. So something that may normally take them 5 minutes may take them a half an hour. Or perhaps the environment, the day is just not going to be that day. So they just can't function that day. And maybe it's a day they need to stay in bed. And that's okay, because they have to cope with it the way that they do best. Invisible disabilities, we never know what's going on physically with them because they may not talk about it. They may not want that label of having a disability. But it's important for us to realize, everybody's heard that saying, never judge a book by its cover. The same thing goes with individuals. You never judge them just based on what you think you know. Some people with invisible disabilities go through other aspects of disability that those of us with visible disabilities don't. So with anxiety or depression, it may be a mood thing, it may be something they feel inside that they're not comfortable sharing. It could be something that they're struggling with emotions that, they cry. Their emotions are night and day from one minute to the next. They may have a buildup of this over time because they're not talking about it, and to the point where they have an explosion of emotions. Everybody's heard that saying of Blue Monday. Well, for some people suffering from depression or anxiety or panic attacks, Blue Monday is every day. It's Blue Tuesday, it's Blue Wednesday, Thursday, and Friday. Sometimes there's bad weeks, sometimes there's bad months, sometimes there's bad years. But we have to be understanding, and we have to watch the signs of how we best can support somebody by making sure that they talk about it, whether it's with a professional or a trusted friend. Talk about the struggles they're going through. I have some amazing friends that you wouldn't even know that they have an invisible disability because they're go-getters. They're out there, they're pushing, they're fighting every day to do something great, to make a difference in the world, to be great parents, to really try and be successful in their own right. But they're struggling. And I would never have known that because, again, we tend to judge that book by its cover. As professionals, we need to learn to work professionally and equitably with individuals with invisible disabilities and be able to be flexible with what they need. Perhaps it is they have to work from home. Perhaps it's they need to work flexible hours. Perhaps it's they need some time to themselves, just to a mental health day, as we call them, to have that day off, to let them get back on track. The more we talk about it, the more educated we are. So if you see somebody that's on the bus, you don't know what's happening with them. They may not be wearing a title that says, I'm disabled. They may not be using a cane or in a wheelchair, but they may sit in those accessible seats. Don't challenge them. There's a reason they're sitting there. Now let's face it, there are people that sit in those seats that just want a seat, but for most of us, we won't sit in those designated seats unless we need it. Perhaps it's somebody that has a breathing thing like COPD, or perhaps it's somebody that has panic when they're traveling and they need to be close to the exit. We don't know what's happening. If you confront them because you think you know something, not only are you making a fool of yourself, but you're making them feel that much worse. So think before you talk, don't be judgmental, and ask questions. Not rudely, but honestly if you're not sure. And for those of you that have invisible disabilities, I encourage you to talk about it. Get the help that you need. Educate us. Tell us how we best can support you. I know that any disability is difficult to live with. I do it every day. And I have had those invisible disabilities from time to time. It's not easy, and people don't get it. But the only way we're going to get it is if we're educated. That's why I really enjoy all these campaigns. I've noticed more and more, and we're talking more about invisible disabilities. Because in the workplace, in the education field, all these things, if we're not educated and know how to accommodate that individual, we're just going to set them up for failure. And that's not fair because they have so many gifts and talents to give all of us. So I encourage you to learn more about invisible disabilities. It could be a learning disability. It could be, as I mentioned, a chronic illness. It could be somebody in your family that may have it that isn't talking about it. It could be somebody in your circle of friends. But the more we learn, the more we educate ourselves, and the more we talk about it, it will become something that's in the norm. Coming up in a couple of weeks is Access Awareness Week. We've just had Mental Health Week, and May is MS month. It's multiple sclerosis. So all of these things may not be visible to us, but we need to talk more about it. So please, let's talk about it. For those of you that have an invisible disability, share with me. Tell me your story. I want to hear about it. And what can we learn from you? Until next time, don't forget to subscribe, like, and share. See you later.